Hi, everybody. Thank you for joining. Good evening, everybody. This is Pinkasha from Pazcare. Today, we've gathered to address a very important topic, and this is also on just the occasion of Women's Day, which is coming on the 8th of March, which is a Saturday. So the idea was to educate ourselves about the cervical cancer and the vaccine which has been created to prevent it. It's called the HPV vaccine. There are so many myths around the usage and the dosage of this vaccine. So it is very, very important for all of us as women to know more about this, be more aware about this, and encourage all of us to get the vaccine because we have it available, which was not there a lot of years ago. So, HPV vaccine, as we know, prevents six types of cancer, including the cervical cancer. But today we would be addressing most of the questions around everything you want to know about the HPV virus and the HPV vaccine. And to help us understand everything about the cervical cancer and the HPV vaccine, we have with us Dr. Lavanya. She is the Chief Medical Officer at Ekincare. Dr. Lavanya, thank you so much for taking out the time and addressing all of us today. If you're on the call, could you please come on the video, and we would love to know about you. And just before we get to know more about you, we would like to tell you about us. So I'm going to run a quick poll, which is about just to know a little bit of how old are we. So if you guys can just answer to the poll on your screens while Dr. Lavanya takes over from me. So Dr. Lavanya, over to you.
Sure, thank you, Pinkasha.
Yeah.
We'll give another
Yes.
10-15 seconds for the poll to end. Shall we end the poll?
I see some people still answering.
Okay, sure.
Yeah, I think we can end the poll.
Okay.
Okay. So as you can see, most of us are in the age group of 30 to 30 to 35. Sorry, I mistyped it. And 25 to 30. So between 25 to 35 is the majority of the group, the
Mm-hmm.
youngsters, youth. Uh,
Mm-hmm.
so yeah, over to you, Dr. Lavanya. I'll hand it over to you. You can start sharing your screen. Yeah.
So, good afternoon, everyone. Thanks for joining today's webinar. By the end of this session, we will cover what HPV, human papillomavirus, is, what are the consequences of HPV infection, and how can we prevent these health consequences, health adversities, by taking HPV vaccination for all the eligible age group, both women and men, including girls and boys. Um, so today, if we see globally, cancer is the top within the top four causes of mortality and morbidity, along with cardiovascular diseases, cerebrovascular diseases, respiratory diseases, and it is on the rise. Because generally globally our lifespan has increased. It's not all bad news, because generally people are living longer, lifespans have increased, and because of lot of exposure for increased number of time to multiple toxins, pollutants, and various materials, cancer is also on the rise. Now, if we take in India, the top two cancers in women are breast cancer and cervical cancer. What is cervix? Cervix is the mouth of the uterus that opens into the vagina. So, because cervical cancer and breast cancer are the top two cancers in India, we have to raise lot of awareness about prevention of these two cancers, and that's the effort that we're putting in. And today's session covers all the ways we can prevent the cervical cancer. Now, the good news is that for cervical cancer, there is prevention, because a lot of other cancers we don't have prevention. We don't have vaccines for cancers. We don't have specific preventive measures. We only have screening for some cancers. For some cancers, we don't even have screening. So, when we have screening and when we have preventive measures, we should all work towards completely avoiding the occurrence of cervical cancer in the society. Now, what is human papillomavirus? Um, this is one of the viruses. It spreads quietly. It spreads through unprotected sex. It's a sexually transmitted virus. And when this infection occurs, there may be mild symptoms of malaise and not feeling well, but there are no major symptoms. So people don't know when they got infected. Now there are so many strains of human papillomavirus. They're all on the they're all circulating. But some strains are more harmful and some strains are less harmful. So I listed just four here, but there are many more strains. If we take as an example, I listed 6, 11, 16, and 18. Among these, 16 and 18 are more harmful. That means they cause cancers, whereas 6 and 11 are less harmful because their oncogenic potential is low. They just cause warts and low grade precancerous lesions. But 16 and 18 do cause cervical cancers, anal cancer, vulvar cancer, vaginal cancer, penile cancer in men, and all these cancers. So now, when we talk about cancers in genital area, we can't fully only blame HPV virus. When we talk about vulvar, vaginal, penile cancers, there are also other risk factors like tobacco smoking, certain exposure to radiation, folate deficiency, and other risk factors. But today our focus is on HPV because specifically if we take cervical cancer, 98.8% of cervical cancers are due to HPV infection, human papillomavirus infection. Now here we have given the percentage of how much HPV contributes. Almost 99% for cervical cancer, 90% for anal cancer, and 69% for vulvar cancer, 75% for vaginal cancer, and oropharyngeal cancer, 70%. When we say this, for oropharyngeal cancer, there are other risk factors like chewing tobacco, reverse smoking, all these causes. Okay. But if you notice here, cervical cancer, it is 99 to 100% almost. Now, the less harmful, less serious health conditions, anogenital warts, cervical lesions, high grade, low grade cervical lesions, genital cutaneous, non genital cutaneous warts on the soles, on the palms of the hand, anal and vulvar regions, oropharyngeal and head and neck cancers are also possible besides the cervical cancer. Now, when we know the virus is causing the cancer, there is one way we can prevent this by vaccinating all the eligible age groups so that when the infection happens, there are already antibodies in the body that fight the infection that will not let the virus grow in the body. So, that's the basic principle. Now, when is the best time to vaccinate? Before we even get the infection. So, if we understand the logic, the rest of the presentation you'll be able to grasp a lot of points better. So, point one is we know that it is due to virus. So, by vaccinating, we are training the body to produce antibodies when it comes across similar structure of the virus, and thus when the real infection happens the body can fight and not let the virus grow in the body. The second one is the whole point of vaccination is if you give it before you are even exposed to the virus, that is sexually before the sexual activity starts, then if we give to the girls and adolescent boys, then we can prevent the infection. Now that said, couple of generations, many generations before, they didn't have the privilege of having vaccine. So we are also extending this to some of the older age groups so that there is some benefit. There is some benefit. In future, as more and more population is taking the vaccine, the age limit will be decreased at some point. But now today in our society, not just adolescent girls and boys, there are a lot of young women that are not vaccinated, hence the age group is somewhat liberal. Okay. Now, every time we talk about vaccination, there is a lot of myths, lot of misconceptions in the society, not just in India, even in West. Now, first question is, if I'm taking the vaccine, will I get infected? No, this is not a live virus. Only parts of the virus are infected. Because of that, there will not be any infection. Okay. And this vaccine is given intramuscularly in 2 to 3 doses based on the age. I'll cover more in the coming slides. So this is an intramuscular injection given either 2 doses or 3 doses based on which age group the person belongs to. Okay. There are multiple kinds of vaccines that came into the market. Lot of research happened when the virus vaccine came. It was bivalent because it was only having 16 and 18 most harmful strains, but later they have included 6 and 11 strains. Now nanovalent vaccine also came into the market where they have included more strains of the virus. The thought behind adding the new strains is that if we are anyway giving the vaccine, why not protect this population even with the less harmful health conditions that this virus causes? Why not protect them for genital warts? Why not protect them for low grade intraepithelial lesions? Why should a person go through the angst of having to go through biopsies and all that? So they kept on adding more strains, and currently we have a nanovalent vaccine that has 9 strains. Okay. Now, um, when you take the vaccine, there are very few side effects, and general suggestion is that take vaccines when you're feeling well. If you're already having some kind of infection or not feeling well in the last 1 or 2 days, better to avoid taking vaccine. Just get well better and then take the vaccine. The only reason for this is vaccine, by nature of it, because we're introducing this into the body, and body has to produce certain immune response. The body will produce some antibodies. So this immune response may cause low grade fever, injection site pain, mild redness, just generalized feeling of not feeling well, mild headache and all that. So already if a person is not feeling well, they may feel even more worse. So because of, and also they may have this misunderstanding that all this is caused by the virus. So always take this vaccine when you're feeling well, or when your child is feeling well. That's when you get this vaccine done for her or for him. Now, the only contraindication for this is if you have had allergic reaction to the first dose. Okay, that's the only contraindication. Everyone else can take this. You will only know when you take the first dose. If you got this allergic reaction, then just don't go for the second dose. And this is also very rare. So be assured that you can take this vaccine. And generally, any vaccine when we give, the general advice is that stay for 10 minutes, whether it is in a clinic or in a hospital. Just sit in a quiet position for 10-15 minutes and then drive back home. This will just give the opportunity. If you have any immediate symptoms or anything, then you'll get some assurance. You can get it checked. That said, the adverse reactions are very rare. Okay. Now to the important point of who should get the vaccination. So remember the logic that we discussed. Whenever we are giving vaccination, it is always best to give it before the exposure happens. And because we are saying this is the virus is transmitted sexually, the sooner you give the vaccine when boys and girls enter into adolescence, the better it is. So with that logic, the age group, the optimal age group is 9 and 15 years. Between the age of 9 and 15 for the girls and boys, this is the optimal age. And when they take this vaccine at that time, generally only two doses are given. The first dose is at 0, and second dose at least after 5 months. So do not give this vaccine before 5 months. 5 months and later, 5 to 6 months is optimal. Okay, because their immune response would be so good at that age, they do not require a third dose. They do not require a third dose. Now, today in our society, mostly the gynecologists and the doctors are targeting girls and advising girls and women. Why is that so? Because they are bearing the most brunt of the situation, because cervical cancer is the commonest cancer, whereas the other cancers are not so common. Penile cancer, anal cancer, and all that are not so common. Because cervical cancer is the top, or sometimes it's the second most common cause. Sometimes it tops, it crosses the breast cancer. Because it is the top cause of the cancer in women, the focus, even for the governments, the focus is to first give it to girls. Recently, they did some allocation in the budget also for HPV vaccination for eligible girls in India. Soon it will be included into universal immunization program, where girls will be getting it for free in primary health centers and all the government hospitals. This is going to happen at some point. The groundwork has started for that. The reason why they didn't include boys is that generally, when it comes to HPV vaccination, the logic is that because girls are most affected, and cervical cancer is leading to a lot of mortality and morbidity, vaccinate the target group first. And when girls are 80% of the girls are vaccinated in the society, automatically herd immunity happens. Even boys are protected because girls are vaccinated. So with that logic, not just in India, even in West, it always started with the girls. Currently, if you see, you will see the gynecologist discussing about vaccinating your girl child. They may not discuss about the boy child at this point. But if you actively ask them, you can get it done, especially in urban areas. In towns and villages, still a lot of girls themselves are have not had the privilege to get vaccinated because of certain cost issues. Comparatively, this is slightly expensive compared to other vaccines, and some taboo and all that is there. um, though it should not be there, because it's a very simple thing to just get one shot, and this can be also clubbed with other vaccinations. Suppose you're going for TT vaccination at the age of 10, you can club this vaccine with that. Both vaccines can be given in the same visit. um, so again, coming back to our original point, right now you will see a lot of awareness being happening in the society. Doctors talking about girls getting vaccinated. You may not see boys getting vaccinated, but if you want to proactively get it done, you can always consult the gynecologist and then get it done. Now this is about girls and boys. Now let's talk about um, age beyond 15 years. Now 15 to 45 years, still women can get it done. Lot of doctors are giving women up till almost 35, 40 years, they are suggesting. But again, in this, we can divide it into two groups. 15 to 26 years, there is more benefit again. There is more benefit. So 15 to 26, whoever is eligible in today's session, by all means, the vaccine should be taken, because there is still a lot of benefit. Beyond 26 years, gradually the benefit goes down. That doesn't mean that there is zero benefit, it gradually goes down. So you can still take the vaccine, but beyond 45 years, there is no point. It is not recommended. In fact, it is advised not to give above 45 years, both for men and women. So if you will see, when you go to the gynecologist office, especially in urban areas, most of the women gynecologists bring this topic: have you had this HPV vaccination? And they do recommend. If you haven't already had it, get the vaccination done. If you have a younger sister or a child in this age group, of 9 to 15, get the vaccination done immediately. Even if she is between the age group of 15 to 26, encourage her, take her for the vaccination. There is still a lot of benefit until 26 years of age. After that, like I said, I mean, it is still beneficial, not as much as 9 to 15, 15 to 26 years age group. Okay. Now, like I said, after 15 years, it is three doses. Zero is the first dose, that is today, if you get it done. After 2 months is the second dose, and 6 months from the first dose is the third dose. And this should not be pushed early. I'm going abroad, or because uh, I have some travel next month, I want to take it at the end of fourth month. I want to take the third dose at the end of fourth month. This is not the right logic. You have to give that minimum time period. Especially for HPV vaccine, it is proven that if you don't give that time period, it is not as effective. So always maintain the time period: 0, 2 months, and 6 months. If it's delayed, it's okay by 1 month. Get it done in an year, but don't take it earlier than recommended. Now we talked about herd immunity, the last point. We also talked about the women above the age group of 26 not benefiting so much. Now, who should not get the vaccination? Women who are pregnant should not get the vaccination. And if they got the first dose and then later they got pregnant and they came to know that they got pregnant, they can delay the second dose until after the delivery. And if it's an unplanned pregnancy, they got the first dose and the next day or third day or 1 week later they came to know that they're pregnant, nothing to worry. There is no need for termination of pregnancy. So whatever the studies are done, they're not in humans. There is a slight effect, so there is no worry or no need for medical termination of pregnancy or anything like that. By chance, if you got it done and then accidentally the pregnancy happened and you got to know 3 4 days later or something like that. But whoever is pregnant, don't go for the first dose. After the delivery, both doses can be started once the postpartum period is over and you recover from postpartum period. Now, during breastfeeding, a woman can get the vaccination because it is not proven to be harmful to the baby. Breastfeeding is not at all a problem. A woman can get all the three doses. For any reason, if vaccination schedule is interrupted, either forgotten or you went out of town for a long time or sickness happened so you couldn't take, you can simply take this next dose. No need to start from zero. Okay. Now, we all know that there is screening for cervical cancer in the form of pap smear. Now, recently, HPV DNA test also is being done in cities, though in villages it is not available. Now, once the HPV vaccination is done, we should not, conclude that we will stop the screening or we don't need screening. The screening should happen parallelly. HPV vaccination in no way changes cervical cancer screening. Okay. Now, the usual cervical cancer screening is by pap smear. I'll come to that in a minute. Um, so we'll talk about public health outcomes. The more vaccination happens, the herd immunity is achieved better. And as communities are getting vaccinated, at some point, the need for 100% vaccination will go down, because at least 80% to 85% should be vaccinated for the herd immunity to be achieved. Now, coming back to cervical cancer screening, the general guidelines are start at the age of 25. In West, they start at the age of 21, but in India, generally, we start at the age of 25. Um, and every 3 years, women should get a pap smear. If three consecutive pap smear tests are negative, many times gynecologist says that you can take a break uh, and come back after 4 or 5 years, something like that. And between 25 and 29, there is only pap smear as an option. But after 30 and above, there is another option. If you combine pap smear with HPV DNA testing, the spacing can be 5 years. Because at the end of the day, 3 years is a very short time. So many people don't want to go and get the pap smear test done every 3 years. It seems like it just happened yesterday and again it's time for pap smear. So sometimes, if they can afford, they go for pap smear, and on the same day, HPV DNA testing. They take the scraping and they send it for DNA testing. If both are negative, both are fine, they can wait for 5 years. That possibility, that provision is there. That provision is there. Now, this screening should continue until the age of 65. After the age of 65, the recommendations are there is not much benefit for continuing screening. If you're fine until 65 years of age, the likelihood of this dysplasia and precancerous lesions happening and them affecting your life and then decreasing your lifespan because of cancer goes down, because of limited lifespan after that. So as of today, the recommendations are after 65 years of age, there is no need for pap smear. So I'll summarize about the HPV vaccination and who would benefit from it, and about cancer screening in just 2 minutes, and then we can open for Q&A. Now, most of the cervical cancers, almost 99% of the cervical cancers, the causative factor is HPV viral infection. Because recently we got a vaccine developed for HPV vaccine, all the eligible age groups should get vaccinated. Because HPV virus also causes penile cancer, anal cancers, and all that, even boys and men will benefit. The best age groups to get the vaccine is between the age of 9 and 15, both for girls and boys. However, the awareness in boys is somewhat neglected deliberately, because countries are focusing on their resources to be allocated to the most affected target sex, that is women, and the age of 9 and 15. That said, if boys can get vaccinated, that's fine too. When they talk about community health and public health concerns, when they talk about how to spend healthcare dollars or healthcare rupees, they always target the most affected group. But that said, in private hospitals, boys also can get the vaccination. If you have a boy in that age group, certainly discuss with the doctor and you can get it done. It's an intramuscular injection, very few side effects, except for pregnant women and who have had hypersensitivity to the first dose. All other people can get it done. Okay. 9 to 15 years age group, there are only 2 doses. After 15, there are 3 doses. Never push and take the vaccine early. Always wait until that period, because efficacy goes down if you take the second dose or third dose earlier. Okay. Now, just because you took the vaccination doesn't mean cervical cancer screening has to be neglected. That should parallelly go on. The best way to screen for cervical cancer is pap smear once in 3 years. But if you're 30 or above, there is a provision that came recently. If you get pap smear along with HPV DNA testing, you can push it for 5 years instead of 3 years. And screening stops at the age of 65. The pap smear screening stops at the age of 65. I'll stop sharing the screen and I'll take questions now.
Okay, guys, time for questions. You can either unmute yourself, ask it directly, or you can also put it on the chat. Do we have any questions? So we have a question, doctor. HPV vaccine is a one-time vaccine. Once you complete the vaccination, there is no need to repeat it every few years. Yeah.
Yes,
Okay,
yes. It's only one time vaccine.
got it. I have a question, doctor. So, before, if I have not gotten the vaccine, I'm 31 years old. Should I get tested first and then get the vaccine, or should I
Mm,
go for the
you
vaccine?
should go ahead and get the vaccine. No
Okay.
need for testing. No.
Any test for breast cancer detection?
Um, we have the screening test, right? We have mammogram for screening. All women above the age group of 40 can get the mammogram, at least two mammograms with 2 years apart. And if there are no lesions, they can relax for few years. Um, so mammogram is the only screening test that is available now at this point. And if any woman has a higher risk, like if she has cancers on her maternal side, mom, maternal aunts, or grandmother, or she's got a certain BRCA genes, we call it. We have family history of the genetic predisposition to cancer. The doctors advise those particular age group to get it sooner than 40 years, and usually in those cases we do ultrasound of the breast because that is better in a younger age group. So these are the tests for breast cancer.
What is the age criteria to do these tests like a mammogram?
uh, Above the age of 40.
40. Okay. What are the early symptoms in the case of illness? Illness, do you mean in the case of HPV infection? I'm just asking the person who, Ambalika.
Huh. HPV infection, you don't have many symptoms. You may feel not so good, mild malaise, and all that, but because you
क्या
don't
नाम
have
है लड़की का?
local symptoms,
जी
because you don't have much of local symptoms, so many times HPV infection you don't even know when it has happened.
Okay.
That's the reason why it becomes a chronic infection. If people have HP infection, they don't even know that they have it unless some warts and all happened. They took small piece for biopsy, or later after all this has happened, they may come to know. But when the infection actually happened, you may not have many symptoms.